Good afternoon, everyone. It is 2 p.m. and welcome to Cook County Department of Public Health's April School Health Webinar. My name is Kelly Jones. I am a health educator with Cook County Department of Public Health, and I am your facilitator and your organizer for these webinars. Let's get started. We have a jam-packed agenda. We have our welcoming announcements, our CCDPH communicable disease update. We have a presentation from Partners for Resilience, the South Suburban Special Recreation Association, and lastly, the American Red Cross. Let's get started. Our objectives are always to keep you informed, share resources, and provide community support to our schools, families, and to ensure that you have a safe and healthy outcome. Little housekeeping, please mute your lines. We want everyone to enjoy and get this information. Feel free to put your questions in the chat, and all of our webinars, including the slide decks, are uploaded to our CCDPH website. There should be on there sometime next week. And this recording is also put on our YouTube page. So if you miss anything, there's a slide you want information off of, you can reach that on our website. It should be uploaded by early next week. Few announcements. Although we're coming towards the end of our school year, we still have our May webinar, so you can sign up and locate all of our webinar information on our website using the top QR code, the bottom QR code, if you are interested in getting our monthly school health newsletter, which comes out within the next 2 weeks. That comes out monthly. A lot of the information that is shared on our webinars are into that newsletter as well, in addition to information from nursing and other units within Cook County Health Department that wants to make sure you have this information. In honor of Mental Health Awareness Month, next month, we welcome the always fabulous Felicia Houston. She will give us mental health and wellness tools and self-care strategies geared towards school staff. She wanted to volunteer her time to make sure that she gave back. As you all know, Felicia presented at our school health conference in October, and she volunteered to give her time back. So she will be coming back next month. So make sure that you register at that QR code, because you know she is fantastic and you don't want to miss any of that information. Let me make sure that everyone is muted. 1 second, please. Alrighty, let's get started. I have to severely apologize. I don't know how much I can apologize. I know that nursing CEUs have not been sent out. I've been having a bit of issue with our issuer, and we are still following up. I will not stop until I get this resolved. I know it's been some time. I profusely apologize. And those of you who know me and have worked with me before know this is not how I run an event. So this will never happen again, but we will make sure we get this taken care of. Here's information on how to contact CCDPH, our CCDPH website, as well as how to report line lists, our school-specific page, and how to request asthma resources. The CCDPH hosted data ambassador workshops teaching those community members who are registered how to access and use data in order to enhance their programs. That full toolkit can be accessed here. And I'll have information next month on an upcoming in-person session if you'd like to register for that. Here are some resources. I'll just quickly go through these because we keep these standing in our slide deck and we have a lot of good information we want to share. So I'll just quickly go through these. Our asthma resources, EpiPen resources for those who are opted into the Rescue Illinois program. For ordering naloxone through your schools, you can contact Jessica Yee for that. Information on how to request vision and hearing screenings for 3 to 5-year-olds. We are hoping to expand that program, but for now we are just doing 3 to 5-year-olds. Information on an upcoming Clean Air School Symposium. You can find this information here on the QR code, and it'll also be in our upcoming newsletter. You can pre-order an asthma caregiver's handbook through Respiratory Association, as well as information on Orland Park's VFC immunization clinics that we've talked about for the last couple months, as well as the dental hygiene clinic for Harper College. More information is within our newsletter as well. On April 25th, there is a Healthy Smiles exam at Prairie State College, similar to the one that's at Harper College, and information on mobile vaccination resources, because this is a time that organizations and schools are trying to reach out to get those organizations in for their back to school events, for to make sure that everyone is all locked and loaded for the October exclusion date. Some mental health resources, we've shared these before, so I'm going to just quickly slide through them and highlight the ones that are new. And for our mental health resources, they are the same. There are no new upcoming trainings, but I want to continue to show these trainings because someone might need this information. The deadline is coming up soon for the Cook County Health Department scholarships for those who are pursuing healthcare field. The scholarships are for undergrad and graduate studies, as well as there is a resource hub through Birth to Five Illinois, which is held within a grant that the Oaklawn Children's Museum have. So for families, you can scan the QR code and you can find resources. There are community organizations who have opted to put their information into the resource hub, and you can find any information that you are looking for within the resource hub, as well as some information from our partners at the Greater Food Depository about food resources. And here are some information on some local food pantries that are going throughout the community. There's a larger list here that I put into a QR code, as well as information on a free public closet that happens monthly. CETA has some various resources, and it's a pretty long, extensive list, but you can see those resources here, and you can also scan the QR code to get to CETA's website for more information. They have things such as vision support, glasses support, and other opportunities. And I'll briefly go through these. We have highlighted them before. Just talk about some of our upcoming community events. I'm sorry, I went by that one a little too fast. Dr. Destiny Kelly, who is one of our speakers for later on, will talk about this connected classroom, professional development opportunity. There is Birth to Five, who I am on their committee. In Birth to Five, Illinois, their Region 1 BC, which is their southern region, will be hosting a virtual parent cafe next week. Yours truly will be facilitating a breakout session. You can register using this QR code. I'll leave it up for just a second. And also, the same organization will be hosting a mental health wellness day for families in May. There is a flyer in English and in Spanish. Information on some more community events that are, I'm sorry, this is a curriculum that is meant to help those who are working with kids, and that could be schools, community organizations, as well as some hiring events for summer for our youth. Very important. Some mental health panel updates are coming up. It's very important. We've been hearing more and more about people, adults and children as well, who are struggling with mental health issues, and we want to be able to support as much as we can. Here's an upcoming panel on understanding ADHD and autism, another mental health wellness fair. And we have a lot of fairs coming up, so you can't say there's nothing in the community. There are a lot of information out, there's a lot of information out there, as well as a trauma systems training sponsored by CCDPH in West 40. Vaping, there is a vaping presentation coming up that is also sponsored by Cook County Health Department, as well as the Respiratory Health Association, and it will be at the Oaklawn Library. There is a Health Explorer Summer Camp for South Suburban College, which will, it's for 6th and 7th graders, so you can pass that along who are interested in healthcare. And I would like to welcome Avi Joseph from our Communicable Disease Unit to give our communicable disease update. Hi, Avi.
Hey, thanks, Kelly.
No problem.
Can go to the next slide. So yeah, looking at communicable disease as usual, we'll start with the respiratory stuff. So you can go to the next slide. Um, yeah, all good news kind of across the board. RSV has finally dropped from moderate to low. COVID is minimal, flu is low. So finally kind of getting out of the woods in terms of respiratory season. I will note that there are a few other things going around outside of kind of our big three of COVID, flu, and RSV. We're seeing just from our outpatient lab data, we're seeing kind of more non-COVID human coronaviruses and human metapneumovirus. So just to note that, there may still be some bugs going around your schools or your community that aren't COVID, flu, or RSV, which are all down. You can go to the next slide. Again, just looking at percent of ED visits due to RSV as we normally do, you can kind of see that the percent of visits due to RSV has started to drop. It still remains a little bit higher than it was at this point last year, but obviously it didn't have that same peak that we did. And then you can kind of see on the graph on the right that this was really driven by our 0 to 4 year olds. So fortunately, RSV has really dropped off in that population. Can you go to the next slide? And then same thing looking at RSV percent positivity on that top graph. Again, steady decline, still a little bit above where we were last year. Bit of a flatter curve than we had. And then you can see that flu B appears to be dropping off. It might be a little bit hard to see, but flu B is that teal bar on the bottom graph where flu A would be red. So you can kind of see that flu B replaced flu A sometime in late February, early March. But even flu numbers have been decreasing as well. You can go to the next slide. And then always keeping an eye out on COVID. Can see that our ICU numbers for this season kind of appear to be pretty similar to that of last season. And again, not a very severe COVID season. I think once again, flu kind of outpaced it in terms of emergency department visits and inpatient admissions. Can go to the next slide. So now for some hot topics. Can go to the next slide. This isn't something that we necessarily need to worry about in Cook County, but there was a plague case in Arizona that was reported earlier this month. Fortunately, the patient did recover. The US actually averages around 7 plague cases per year. They're mainly in kind of west, southwestern states. I'll show you a map kind of where those are concentrated later on. About 12% of cases in the US are fatal. Most of them take this bubonic form. You probably heard the phrase bubonic plague that kind of refers to this proliferation of the infection in the lymph nodes, which kind of causes it to be swollen. So plague is spread by a bacteria, Yersinia pestis, and it's transmitted to humans either by fleas or by exposure to rodents, rats, prairie dogs, things like that. Um, and there's really only person-to-person spread, kind of what you would think of, classic Middle Ages type of plague spread from person to person with pneumonic plague. Um, so there are actually three types of plague. Bubonic, which I mentioned, which kind of has this characteristic, the lymph node swelling, septicemic, which can also involve internal bleeding and skin tissue death. Sometimes with septicemic plague, you'll see pictures of people with totally blackened limbs or stuff like that, just from where the tissue has died off. And then pneumonic, it involves developing pneumonia, shortness of breath, all that, and that pneumonic plague can be spread from person to person as opposed to the other two types. And then how we prevent plague, reducing rodent habitat and exposure, wearing gloves, using insect repellent, basically just um, avoiding fleas and rodents in any way that we can. We can go to the next slide. So we have this kind of picture of, the Black Death in Europe, in the Middle Ages. We know that plague killed about 25 million people in the 14th century, which was a third of the population. Whereas now, we rarely hear about plague. Like I said, we average around 7 cases per year in the US. So just kind of historically kind of wanted to go back through kind of how we got to this point. So one of the first kind of public health measures that were that were instituted in Europe to counteract the plague was this quarantine. So that actually comes from the Italian word quarantena, which means 40 days. So a ship traveling to Italy during this time of high plague activity, they would kind of be forced to park outside of the city or town that they were trying to embark on or disembark on, and they would have to be stay there for 40 days. So that's where quarantine comes from. And then gradually there kind of became this institutionalization of public health. So, we were getting death records, marking how people died, where they died, what they died of, um, creating hospitals specifically for isolation for patients, and then sanitation, implementing sewage systems, drinking clean water, waste removal, kind of removing the habitats for, rodents or some of these other vectors for disease. And then obviously, the discovery that germs cause disease was huge for plague prevention. It established that fleas and rodents were kind of the vectors. Um, in America in the early 20th century, there was actually like a pretty substantial rat eradication campaign. So there were a couple of substantial plague outbreaks in the US actually in the early 1900s, I think in the 1920s. But after these campaigns, the plague has really been kind of few and far between. And then obviously the development of antibiotics, and now we have this kind of robust disease surveillance system. So you can see on that map on the right, plague cases over, you know, 1970 to 2023, and they're really all kind of concentrated in that Southwest area and kind of the Western states. It looks like we may have had one case at some point in the last 53 years or so. But fortunately, I was not working on it because I would not want to work on a plague case in Illinois. Um, can go to the next slide. And then just an update on our current measles situation. You can kind of see on that graph on the right, that's actually our measles cases by week for the last 4 years. So you can see, 2022 really didn't see too much at all. 2023 and 2024 ramps up a little bit, but the last 2 years have been um, quite bad in terms of measles proliferation in the US. We're already at 1,748 cases this year. We had, over 2,200 last year, and that was our worst year in a couple of decades. So unfortunately, it does seem like we're kind of at this level of disease transmission, at least for the foreseeable future. I believe I had mentioned this South Carolina outbreak maybe a couple of months ago that fortunately does appear to have slowed down. But Utah now appears to be the epicenter of the new outbreak. Um, there's this idea in epidemiology for measles in particular because it's so infectious that you need to have kind of like a 95% rate of immunity in the population to kind of eliminate measles. And I think I saw that Utah is at around like 85%. So it's unfortunately possible that this outbreak will continue for some time. And there were already worries that the US would lose our measles elimination status and that this kind of level of, endemic transmission that's occurring within the United States will become the norm going forward. You can go to the next slide. I think that's everything that I had. Again, my contact information is there. And if you want to get added to our weekly respiratory listserv, feel free to reach out to my colleague Courtney. I'll stick around for a little bit in case anybody has questions, but if not, thanks for your time.
Thanks, Abby, for our update. We appreciate all of that information. Before I introduce our next presenter, I just wanted to lift up Katie's request in the chat. Katie wants to know if anyone is going to the ISBE Wellness Conference in May. She could use a ticket. She already paid for her hotel and transportation, but forgot to register. So please help Katie out. So I just want to lift that up before we go to our next presenter. I would like to welcome Dr. Destiny Kelly and Chrissy Bombella from Resilience. I'm sorry, Partners for Resilience. I'm so sorry, I had a flub. I don't see if Destiny is on or not, but I see that Chrissy is on. Chrissy, would you like to start? I think I put Destiny slides in first.
I'm here.
Oh, you're here. Hi, I'm glad
Yes.
you're here. No problem. And I'm happy to advance your slides, but if not, there's a take control button at the top of your screen. If you'd like to look at your presenter notes, it's up to you.
Okay, you might, I don't see it, so I'll just say next slide if that's okay.
No problem.
Alrighty. Hi, everyone. My name is Destiny Kelly, and I'm the Southland Project Organizer with the Partnership for Resilience. We're a statewide Illinois nonprofit working to build trauma responsive schools, families, and communities. And so we exist to mitigate the impact of toxic stress in the lives of children, their families, and the communities where they live. And we do this by focusing on building trauma responsive schools. And we like to take a collaborative partnership approach and work hands on in the school with the educators, as well as building relationships with resources outside of the school and in the community. And as I said before, we have various initiatives across Illinois. Next slide, please. And so this work is important because trauma is in your classroom, whether you can see it or not. We know that adverse childhood experiences, or ACEs, which includes things like abuse, family dysfunction, domestic violence, and more, are rising in children. We expect that 1 in 5 children experience 3 or more ACEs. And so when you think about this kind of cumulative stress that's building in children, that changes how their brain is developing. And it also affects how they respond to stress and regulate their emotions, which we know um, is a really important part of being in the classroom. And so it's affecting their ability to learn. So we think it's really important to do this work because school is sometimes the only place where students can experience this type of safety and support. Next slide, please. And so we do this work through professional development. We provide training and coaching for educators. We also have a community school model where we, like I said before, we connect a lot of different resources across these health, social, and family service spectrums. All of our work is trauma responsive and healing centered with equity and social justice at the root of it. And then we also do a lot of family engagement, and we like to center families as essential partners in this work because without the families, there would be no schools. And then on the right, you see the different initiatives that we have. So I'm in the Southland Initiative, but we also have one in Southern Illinois, as well as Springfield. Next slide, please. And so what this means is that we want to help educators build capacity, not add to the burden. And so we have some PD workshop topics that we like to do that focus on trauma-informed responsive practices, SEL, educator wellness. We can provide this to educators as well as parents. We have a community referral network where we can build some connections between some resources. We help provide action planning, which Chrissy will talk about in a little bit. And we also have parent mentor programs. And this allows parents to have this leadership right inside the classrooms and kind of build that bridge between home and school. Next slide, please. And so here you'll see a QR code. I just wanted to highlight that we have a link tree with all of our important links. I also have my email listed on the bottom of the page if you want to contact me directly. Like Kelly mentioned earlier, we have a session coming up in 2 weeks on building the gap between home and home and school. And so I'd love to have you guys visit and come. It's completely free. It's on Zoom. And you also can get some PDHs or CEUs if you need it. And so thank you guys for having me, and I'd love to connect.
Before we bring on Chrissy, are there any questions for Destiny? This is a great opportunity for our school staff to get some much needed support. If there aren't at the moment, please feel free to put them in the chat and then we will make sure we address them later. But I'd like to thank Destiny and bring on Chrissy. Hi, Chrissy.
Hi, how are you? I
Fabulous.
hope
How are
everyone's
you?
doing well. Good. I hope everyone's doing well today. So I work with Dr. Destiny Kelly. My name is Chrissy Mobella. I am the Director of Programs and Initiatives for the Partnership for Resilience, but I am also the Regional Liaison for Resilient Supportive Schools Illinois, which is an initiative that is brought together by the Illinois State Board of Education with the Center for Childhood Resilience and the Social Emotional Learning Hubs that are throughout the state of Illinois, with Social Emotional Learning Hub 1 being the one for Cook County. And then CPS is another portion of that, Chicago Public Schools. Next slide, please. So I want to just share with you an overview of Resilient Supportive Schools Illinois. RSSI is free and a voluntary statewide initiative that helps schools assess where they are and build their own improvement path on their terms and at their pace. So it really is looking at school climate and culture, but how those things impact academic performance. So to get started, a school principal would complete a short 15 questions screener, excuse me, in IWAS. And then from that IWAS site, that information gets sent to the RSSI app, which has all of the data in it. That ends up generating personalized data, and it's a snapshot of where the school is at as it relates to the 4 pillars that you see on the slide. So we look at it through the lens of mental health supports, social emotional learning, trauma responsive healing centered engagement, and then cultural awareness, responsiveness, and equity. And so that is where it's really important to think about it. There's no prescribed program in that respect. It's not a checklist that a school has to follow. It really is having a school have the ability to look at their data in an integrated way that helps them to identify what their school community may need the most. Some schools lean into mental health supports, others focus on trauma responsive supports, or even culturally sustaining practices. Every school's plan is intentionally looking different because every school community is different. So I know I just keep coming back to that, but I just want to make sure that that's really clear that it's differentiated based on the school's interest. So when we think about this, it's about looking at academic progress and student well-being. And sometimes those things are seen as being in 2 separate tracks running parallel. But what we have done with this program is RSSI is built on the understanding that that is not separate, that organizational culture is what helps to support academic progress. So when adults, what we see is that when adults feel in the building, feel supported and valued and connected, they have the ability to show up more fully for their students. And when students are feeling safe, then they have more capacity to be creative and take risks and learn. And that's where RSSI helps schools build the conditions that makes strong teaching and learning possible. So if we can go on to the next slide. The other piece to think about with all of this is that for community organizations that are in the room, that matters for you too, because RSSI is an entry point. We advocate for that community and school connection. So we actively use that to look at the data and build improvement plans for the schools through that lens to help create stronger partners. So that's just something to also keep in mind here as well. And so, like I mentioned, principal first goes into IWAS, takes the 15 question survey. That's the Illinois state system. So then after they take those 15 questions, the school then can gain access to their data snapshot. It usually takes about 5 or 6 days for that to kind of all come together and synthesize together. And then from there, they can go into the action planning platform, which has training resources and coaching support, which are all at no cost. And then the SEL Hub partners like us, Partnership for Resilience, helps to support the schools. So there's coaching that's also available that is free of charge. And any of the professional learning that is completed on the site can earn PD hours or CEUs for those who need them. So we're just kind of here to make sure that schools can make sense of their data and turn it into practice. And so that is really what we're thinking about. So I'm going to close with this information. Just think about most of the administrators and educators that I'm talking to really think about how can we support academic growth while also taking care of staff and students, because it's all about the human part of the work. That's where RSSI really helps, is that we're not adding more to your plate. It's about how do you help use what you already have more strategically and more intentionally. So the QR code will take you directly to the screener, and the handout, I sent a handout, I don't know if you can drop it in the chat, that provides more information to share with principals or reach out to connect with our team. And I'll also drop right now a link in the chat to explore the website and even to register, because anyone can register for free. And that's about it. I want to thank you so much, and I'd love to talk more, but please feel free to reach out directly. My contact information is on the slide.
Sorry, I moved a little too quickly. Thank you to Chrissy and Destiny. Feel free to put any questions in the chat, and we'll make sure we review them before the meeting is over. And thank you for that information. It is fantastic. I'm so glad I met you all to be able to share this information with schools, and we hope to continue our partnership. Thank you so much.
Thank you.
No problem. I'd like to welcome Heather Specht from the South Suburban Special Recreation Association to talk about their offerings within the community. Hi, Heather.
Hello, hi everybody. Yes, so my name is Heather Speck from South Suburban Special Recreation Association. And I'll kind of just give a little bit of background information about what a Special Rec Association is, and then just kind of what the different types of programs that we have to offer. If you want to go on to the next slide there. So what is a Special Rec Association? It's a cooperative of park districts and villages that provide recreational programs. It can include a bunch of different things such as Special Olympics, which I'm sure you've all heard about, day camps, special events. We do weekend trips. And all of our programs are offered for children and adults with disabilities or special needs. So next slide, please. So a little bit of background about a Special Rec Association. So back in 1969, Senator Harris introduced the legislation that enabled SRAs to be formed. So there was a special legislation in Illinois that enables park districts and villages to levy a tax, a special tax. And then when they levy that special tax, they're able to be part of a cooperative agreement with a Special Rec Association to provide services for individuals with disabilities or special needs. So right now there are more than 30 cooperative agreements throughout Illinois, serving more than 200 communities in the state of Illinois. What is something really unique about Special Rec Associations is that Illinois is the only 50 states in the whole 50 states that have Special Rec Associations in the state. So that's a great opportunity for Illinois that we are able to do this and have these programs for individuals with disabilities or special needs. Next slide, please. So just a little bit of history about us. We formed in 1973 with only 3 park districts: Homewood, Flossmoor, Olympia Fields, and Park Forest. We have now grown to 9 member districts. Our office is currently in Tinley Park, but we serve a lot of the south suburbs such as Country Club Hills, Hazel Crest, Madison, Oak Forest, Park Forest. We offer virtual programs as well as special events as well too. That's the next slide. We currently offer over 40 programs and 30 special events per season. We have 4 different seasons that we offer: the fall, winter, spring, and then summer. Summer is our biggest, busiest time of the year that we do. We offer a lot of day camps and that sort of thing. All of our programs are offered for all ages, including early childhood, youth, and teen and adults. And then we do have some special programs for individuals with severe and profound disabilities. We do programs for individuals with physical disabilities. So it doesn't matter what type of disability a person has, they can participate at our programs, and all ages are welcome. Next slide, please. We have a special selection of programs and special events such as adapted sports for individuals with physical disabilities. Kind of touch base about that. We do offer door-to-door transportation for programs and special events for adults with physical disabilities as well too. And then we also have pickup points for transportation for special events that are not held within our member districts. Like, so we have those 9 member districts that we serve. But we, if we go to maybe like a White Sox game this summer, we'll offer a pickup point here at our office and then a pickup point at Coyote Run in Flossmoor. And then we'll head on to that special event wherever it may be. And then when we drop them off, we'll drop them off at Coyote Run in Flossmoor, and then we'll drop them off here at our office in Tinley Park. So that way it helps families out, and we're not expecting them to drive them all the way out to Chicago when we're doing those events. Next slide, please. So some of our early childhood and youth programs are for ages for children ages 2 to 12. Some of those types of programs we offer swim lessons. They're very popular. They always tend to max out every season. We do day camp during the summer. That's our busiest time. Our day camps are Monday through Friday from 9 a.m. to 3 p.m. We have T-ball programs, little kicker soccer. We do field trips. So those are just some of the different types of early childhood and youth programs we have to offer. Next slide. For Special Olympics, which I'm sure most of you have heard about Special Olympics, here are some of the different types of programs we have to offer there. Basketball, bocce, bowling is a huge one, golf, powerlifting, soccer, swimming, track and field, and volleyball. So those are just a few that we are offering. We're finishing up our track and field season right now. Spring games are coming up at the end of April, and then we'll be starting our softball season as well too. That's going to be coming up here starting in April. So we're always very busy with Special Olympics and those types of different programs. Next slide, please. So we also do inclusion. So inclusion is we provide inclusion services for all of our member districts. So what that means is if a participant goes to their member district and wants to register for their member district program because maybe it's closer to their house or they offer longer hours than we do for like summer camp or something like that, they can do so. And then what happens is the park district reaches out to us and they say, hey, we have somebody with autism and they're 12 years old and they need a one-on-one aide to work with them. We would provide that one-on-one aide to work with that individual who has a disability. So it's a great opportunity for families to also participate at their own home park district as opposed to coming to our programs, but having that individualized support that they would need for their child to succeed in that program. Next slide. We also have a mind-body balance program for veterans. So this is a program designed for veterans with an honorable discharge and a disability rating of 10% or higher. It provides a 1-year membership to the veterans and a personal training session option and monthly social activities. The injury does not have to be related to the service. So the member districts in our area that offer this program is Homewood Fossmore, the Madison Community Center, Oak Forest Park District, and Tinley Fitness. Next slide. And so we also do outreach events too. We try to go to the resource fairs and that sort of thing, just to kind of get our name out there. A lot of families don't know that we exist and that we are here as a resource for individuals with disabilities. So if you ever know of an outreach event or anything like that, that maybe we could partner with or come out and hand out information to families, let them know. We go to job fairs, different events at libraries and that sort of thing. We also partner with local service organizations to raise awareness and reach more families. So we really try to get out there and let families know that this is a resource for them that they're able to utilize as well too. And the next slide. So fundraising community support, we are tax funded through our state dollars. So we also need to raise money through fundraising. One of our bigger events is our Ricky's Ride motorcycle run. We do a Putting with Purpose mini golf outing, and all the proceeds from those programs to go directly to our scholarship program. So we do have a scholarship available for our residents. They can apply if they need financial assistance as well too. And they won't cover 100% of that program cost, but it will cover substantially a good amount of that money. So the fee that they would have to pay would be pretty minimal. And then the next slide. And then our staff, we have full-time staff that have backgrounds in therapeutic recreation or other related fields such as special education or adaptive sports. All of our part-time staff have to go through a pretty extensive training, background checks, and that sort of thing. They can include drivers, inclusion aid, rec leaders, our day camp staff, and interns. And then next slide. And yeah, so that's just my contact information there. Like I said, we are located in Tinley Park. Our phone number's there, our website. My name is Heather. So if you have any questions, you can give us a call. Or my email address is also pretty easy. It's heather@sssra.org. 3 S's ra.org. So that's all I have.
Thank you so much, Heather. I'm glad I was finally able to get you guys on a call. I've been singing your praises wherever I can. I've in a couple mom groups, and I've heard recently some moms with kids who had some special needs having trouble registering them for summer camp. One mom said she was denied summer camp because they didn't accommodate her child. So I told her to contact you guys. So I'm very happy that you guys are here and happy to share this resource with people who need it. So I'm glad that you are here. Thank you so much. If there are any further questions for Heather, please feel free to put them in the chat. I don't know if you could see the our chat, but Anna says this is a wonderful program. Thank you for sharing. So we're happy to have you guys here.
Thank you very much for having us. We really appreciate
Thanks.
it.
No problem. I would like to welcome Teray Kane from the American Red Cross to talk with us about emergency preparedness. I told you guys we had a jam-packed session this time. Hi, Teray.
Hey, how's it going?
Great, great.
Thank you for having me today. And also thank you to the partners that are on today. I mean, I'm hearing about so many amazing services, so thank you for having me here today. All right, we can get started. So yes, again, my name is Teray Kane. I am a community disaster program manager with the American Red Cross. My focus is working specifically with diverse communities and supporting them before, during, and after disasters. Essentially, we are also doing stuff with strengthening systems, partnerships, and programs to support accessible and equitable disaster preparedness, response, and community recovery. And so essentially my work is grounded in really meeting the needs of the community during, a disaster. Next slide. And then this is just the Red Cross mission. So essentially it's our why. And we like to always emphasize being community-based and volunteer-driven. And so just ensuring that we are able to provide support across the full disaster life cycle during different things such as floods or tornadoes, hurricanes, and things of that nature. Next slide. And so today we're gonna kind of speak specifically about the American Red Cross of Illinois. Currently, we have 5 different regional chapters that span the whole state of Illinois. For me specifically, we're going to talk about disaster cycle services, which is where we specifically focus on prepare, respond, and recover. And we also have a huge focus on community engagement when it comes to preparedness education, outreach and partnerships, and then trust building, of course. We also have additional services that a lot of you guys may already know about. So our blood services, where we do blood drives in different or in partnership with different organizations, service to armed forces, training services, which is where we do our CPR and AED training, and then international services as well. Next slide. And so specifically about disaster, so that is the sector that I work under with the Red Cross. And so these are kind of our 3 main topics when we're talking about disaster, right? So our first priority is always helping people become more resilient before disaster strikes, right? We want to reduce harm and improve recovery outcomes. So we're providing education, tools, and resources that help families and communities understand risk and know what to do. And so some of our programs, which we'll talk about a little bit later, include our fire safety education, emergency kit guidance, as well as capacity building within the community through our trainings. When we're responding, essentially, we respond, right? So whether when a disaster hits, whether it's one family affected or an entire region, we work to really mobilize immediately. And so we're looking to deliver essential relief. So that can include sheltering, food or cleanup supplies during like flooding or tornadoes, health services, as well as emotional support. And then the recovery stage. So during this stage, recovery doesn't end when the immediate crisis passes, right? So we see that many families and communities need that long-term support. And so this is where we're able to really leverage some of the partnerships we have within the community to ensure that that recovery process meets the needs of, whatever neighborhood or community we're in. And so we are able to do financial assistance or casework services, whatever we can do to help in that long-term recovery and support. Next slide, yep. And so I always like to talk about our DAT response because this is really like the heart of the disaster team or the disaster department within the Red Cross. And so essentially our disaster action team are comprised of almost 90% volunteers, and so they are able to offer immediate services during disaster-affected individuals or to disaster-affected individuals. And so we are looking to do, that work with compassion and comfort. And we offer different services. It can be financial support or canteen services for those in need. Fun fact about the DAT team, they, especially in the greater Chicago area, they are responding to 3 to 4 fires each day. And so they're going out sometimes, right after the fire occurs or the next day when the family is in need of support or sheltering. And so this is really like the heartbeat of our team, right? And so we're able to offer, the services to get people shelter, and that could include, maybe funds to have an Airbnb or a hotel, or working with schools and churches and community centers to offer sheltering to people in need. So this is really the heartbeat of our program. Next slide. And then, of course, I want to always ensure that, our partners and people that we're working with have this information. So this is the number to call if you do have a community or an individual who has encountered an emergency and is in need of services. 1-800-RED Cross is for the general public. And then the number you see at the very top is for agencies that may refer people, or agencies that are calling in to refer, and inform Red Cross about, an emergency that occurred. Next slide. And so the next sector will be about some of our preparedness programs that we offer to community members. We are focusing on youth education, community engagement opportunities for students, as well as staff that we like to offer to our community, as well as different, schools and community centers that are on the call. Next slide. So this is one of our most famous programs, Prepare with Pedro. And essentially it's designed for kids grades kindergarten through second. And so in the pictures here, you can see us in classrooms with different age groups, and we are essentially, this is where we have our Red Cross storytelling with kids, right? And so we have stories that relate to fire safety or tornado safety, as well as flooding. So, things that are disasters that are relevant to the Illinois region. And so it's just a really cool way to allow the kids to be hands-on with storytelling, and then teach students how to be prepared and take action. And this is one of the preparedness programs where we are reaching over 500 youth per day through this program. Next slide. Our Red Cross Club, and so we offer this at the high school level as well as the collegiate level. And so we are working with students. Usually it's 3 or more with an advisor to kind of help, get the club going. And so this is really good because it allows students to really touch different parts of our mission and different parts of our lines of service. And so we have them doing blood drives, which is really popular during like the back to school time in August and September, disaster preparedness, or doing classes like the Prepare with Pedro or the hands-only CPR as well. And so we have, I believe, over 60 clubs within the Illinois region, and that includes at the high school level and the collegiate level as well. Next slide. Our home fire safety campaign. So this is my favorite program that we do within the disaster services. We essentially want to offer education to help families and even different organizations, schools, churches, this information to be educated about how to prevent a fire. And so actually today we did a sound the alarm event. And so that's when we go into the neighborhood and we offer free smoke detector installation. And so we're also offering resources to make a fire escape plan. So you're doing that with your family or whoever else lives within your home. But we've also done it with organizations and going into, senior buildings. The sky is the limit, right? And so this is a really popular program, and it really allows us to mobilize and really expand our partnerships within communities. So that's always really cool. We also offer bed shakers for those individuals who have special needs and may, need that extra, I guess, assistance when a fire occurs in the home. Next slide. And then our hands-only CPR. This is also a really popular program when we go out to different schools and churches. And essentially, it's designed to teach individuals of all ages how to deliver life-saving CPR care without those rescue breaths, right? And so this is also another piece of us trying to build capacity and allowing us to teach, our volunteers, get them trained up in order to offer this service to the community. And then they can also, do that in return and just kind of pay it forward and keep that training going. So I love that as well. Next slide. And then sheltering. So this is a really, really big part of the Red Cross mission, especially within Illinois and really internationally as well for Red Cross. And so this is essentially what we offer when there are different, disasters that occur. So when the tornadoes occurred in Kankakee a couple weeks ago, you'll see in this middle picture, that's us standing up a shelter at Kankakee Community College for those who, were in need of somewhere warm to lay their head, or even if they wanted to, have a hot meal or some hot coffee, just kind of, to kind of get away from the craziness of the disaster that's happening, right? And so we are always looking for partnerships in order to offer this service to the community. And so some of those shelters, we stand them up again at community centers, churches, schools, whoever is open to, helping the community and opening their doors during a time in need. Next slide. So I kind of went through all that information fast, but hopefully you guys were able to get some good info from it. If you or anybody else may want to request a preparedness program for your organization, I did make a QR code here that you can scan. You also can go on the Red Cross website and it'll take you through the preparedness program to essentially ask for one. So that is kind of how we can get those requests in, and we'll get some of the team members from the disaster department to come out and offer that service. And I think that may be my last slide. Yep, perfect. Thank you.
Thank you for that information, Teray. I'm so glad I found you. I've gotten quite a few requests from people in the community as well as school staff asking for preparedness assistance within their organization. So I'm glad I was able to find that resource, and hopefully we keep you busy. Thank you
Yes.
all for coming. Are there any questions for any of our presenters? You can unmute or put your comment or question in the chat. While we are doing that, I want to again say thank you to Avi, Dr. Destiny Kelly, Chrissy Bambella, Heather Speck, and Teray Kane for taking their time out of their busy schedules to give us fantastic information for the community. And we'll make sure we pass it on and share. And we've got some comments. These are amazing programs. Thank you so much, Jenna. If there are no questions, I'll just reiterate that next month is Mental Health Awareness Month, and the fantastic Felicia Houston will be on our call to give us a special training. If any of you have been on our calls before and have seen Felicia in action or were at our conference, Felicia is well renowned in the mental health field in the community, and she will give us some self-care strategies and some tips. So you can register for our last session for the school year using that QR code. And also, if you would like to sign up for our school health newsletter, which comes out in a couple weeks, there'll be some of this additional information that we shared on the call, as well as other information from other units that would like to share with our school community. You can sign up to get that monthly. If there are no other questions or comments, I'd just like to reiterate that this whole slide deck will be posted to our website next week, as well as the recording. And you can also view the recording on our YouTube page. So enjoy this beautiful weather. It's going to be 50 tomorrow and raining. So enjoy today. I will let you have 5 more minutes in your day. Thank you so much. Enjoy and be well, and we appreciate your partnership. Have a great day.
Thank you.